very quickly, we're going to jump in because for the gentleman in the back, it does take a while to go through these slides. I do them as quickly as I can, but I don't want to talk too fast because then sometimes things aren't understood, or sometimes we'll get into language that I'm used to, you're not. So we want to make sure that you understand what we're discussing and what we're talking about. This slide came about here a few weeks ago. We've been doing these presentations for about 7 years from Managed Care Partner standpoint. We do them in Missouri, we do them in Illinois. All of our member hospitals have the opportunity to have us come out and do these. And we've used a phrase over the years that it's open season on senior citizens. So my partner came up with this wonderful slide, and I like to point it out because I think it's really cute. Nothing is for sale. We're not here, Paris is not here to sell you anything. It's about getting you the information so that it's not a surprise. So that you can actually look at Medicare and the manual, and actually know some of the language. You'll see it and you'll go, oh, I remember this. And so that's what we're going to talk about. We're going to talk about Medicare. We're going to talk about Medicare health plans. We're going to talk about Medigap. It all goes together, but yet it's all separate. So we're going to talk about that in detail. How many of you have received your new ID card? Fantastic. The most important part about that, as we've been drilling everybody for 2 years, is we're no longer putting the Social Security number on. And that's important. Way back when my father died way back in 1972 when I got my first Social Security card, everybody was concerned. Don't give that out, don't give that out. What have we been doing for umpteen years, all right? So we're going to talk about Medicare, how to access it, what the alphabet really means. What is A, B, C, and D? We're then going to talk about Medicare Advantage. And Medicare Advantage is the new kid on the block, but it's also some of the most misunderstood material on the block. We're going to talk about Medigap, or Medicare Supplement Insurance. We're going to talk about Part D, which stands for drugs. We're going to talk also about how Medicare Advantage and the prescription plans do or do not go together. We're also going to talk about enrollment, when you can enroll, some of the special resources that come with enrollment, and how you can tap into those resources. So I asked earlier, when was Medicare first brought up? And you're correct, it was the year you were born, 1945. However, it took another 16 years before President Kennedy was able to bring it back up. And it took another 4 years before President Johnson was able to turn it into a law. Up in the corner, President Truman received the first card. So we always think that's a great picture. Today, there are nearly 63 million plus participants in Medicare. And that's growing every day because of baby boomers. We have a lot of people who are turning 65, all right? So we're going to talk about, and I want you to think about, the two roads of Medicare. Original Medicare, Medicare health plans. They're two totally distinct roads. They're never going to come together. They're never going to cross. They're just going down the road. So you have to choose which road you want to go down. Original Medicare is my left hand. That's the first road. Medicare provides you the coverage, parts A and B. Medicare health plans, which includes Medicare Advantage, is the second road. That road can include prescription drugs, but it may not. You have to be very careful with that. The key to that is it's a replacement of original A and B. So when you work with a Medicare Advantage program, you're working with an insurance company, you're working with a union, you're working with an employee retirement program through work, anything but working with original Medicare. That's the first thing to understand. So those two roads, you're determining, what do I want to use? What do I want to work with? Do I want original Medicare? And do I want a prescription drug plan? Do I want a supplement or a Medigap? On the other road, Medicare health plans. That's the Medicare Advantage. And again, you have to decide if you want prescription drug coverage. Right? So let's talk about Medicare. This is where the confusion starts, because Medicare A, B, C, and D, do we know what those are? We're going to when this is all done. Medicare Part A is hospital. Anything that is done in the hospital falls under Medicare Part A. You also have skilled nursing facilities and home health care. Home health care and hospice are part of that. Part A is what a lot of people call the free part of Medicare. But we also point out nothing is free in life. You've earned Part A. As long as you worked in your lifetime and accumulated enough quarters, then Part A you don't pay an additional premium for. That's why they call it a free part. However, there are deductibles and there are co-pays that can come into play. Under Part B, that's everything outpatient. So that's going to the physician, that's going to physical therapy, that's buying durable medical equipment like a wheelchair or crutches, okay? It is also covering preventive care, screenings, drug screening, or excuse me, cancer screenings, those types of items. In Part B, you pay a premium to the government. Most people have it automatically deducted from their Social Security. But lately, there's a lot of people who are not retiring at 65. They're retiring later. So they can opt out of Part B. They don't have to pay that premium until they actually retire. So it's important that you determine where you're at. Are you retiring? Are you not retiring? Because that Part B, once you start paying it, it never goes away. It doesn't matter which road you went down, you're going to pay that Part B to the government, either by subtracting it from your Social Security or by writing them a check. Again, Part B has its own deductibles and coinsurance. Now there are things that are not covered by Parts A and B. And I always point out the most important ones are the ones that people look for, which is routine dental care, routine eye care and eyeglasses, and for the diabetic, syringes and insulin. Those are not covered by A and B. There are some plans who will give you some preventive coverage when it comes to vision and hearing and dental, but it's not a true dental program. Medicare Alphabet C is the Medicare Advantage plans. Medicare Advantage are those plans that you are buying either from an insurance company or through a retirement program. State of Illinois offers Medicare Advantage programs. All right? Those are not Medicare. They're Medicare Advantage. They are a complete replacement of A and B. So when you do a Medicare Advantage, you're no longer using A and B, you're using the plan designed by that insurance company. Does that make sense? They're going to be, for the most part, they're PPOs, preferred provider organizations, or HMOs, health maintenance organizations. Health maintenance organizations, we've gotten used to those over the last 30 or 40 years, but there's rules with the HMOs, so we'll talk about that. Again, the companies that are selling these Medicare Advantage are all licensed to do so by Medicare. They have to be licensed by Medicare or they cannot sell the product. Again, these plans are going to have premiums, they're going to have deductibles, they're going to have coinsurance, but they don't have to be the same as Part A and B, how those are structured. But they have to have some deductibles and coinsurance. Now, Part D is what we call prescription drug plans. Otherwise, the easy way to think about it is D stands for drugs. Okay? So beginning in 2006, that's when the government first put the drug plans together. Back then, we had a very large donut hole gap, and it was brand new. No one really understood what we were getting into. But it was a whole lot better having some coverage than from 1965 till 2006, you had no coverage for prescriptions unless you were in the hospital. All outpatient prescriptions you were paying for out of your pocket. All right? Again, each plan can have a different cost. Each plan has different deductibles. We're going to go through some of those in detail. Some other Medicare health plans, Medicare cost plans, we don't have one in the area because we have PPOs available. The intent with that, there are some states that don't cover out-of-network, and so this was a way to cover out-of-network coverage. PACE plans, if you qualify for nursing home level of care and you're able to live comfortably that way, the PACE plans will come into play for you. Programs for all-inclusive care for the elderly. Medicare and Medicaid, some of you may have heard that called Medi-Medi. What I want you to think about is that Medicare is federal, Medicaid is state. They coordinate so that that beneficiary basically has zero cost out of their pocket. With the new introduction of Medicare HMOs in Illinois just this year, that's changing a little bit, but Medicare and Medicaid, when you're what is called a dual eligible, there are different rules for that. And we would have to go through that specifically with you if you qualify.